Imagine a country free of HIV. Is this an achievable goal? Imagine the resources that would be freed up. The money could go to another cause, to hunger, to housing, to education. What can you do to help stop the spread in your country? In Jamaica, approximately 1% of the population is infected with HIV. This may seem like a small number, but it includes about 30,000 people, all living on a small island. How many citizens do not know their HIV status? Do you know that half of those with a positive HIV status are among the working age group? How can this age group maintain the country's productivity with such a large number infected by HIV? Know your status, get tested, prevent the spread. Hello, I am Kate Jenkins, and today I will be discussing the impact of HIV on the small island of Jamaica, located in the Caribbean Sea, just south of Cuba. The island is 10,991 square kilometers. That is just a tad bit smaller than the state of Connecticut in the U.S. The current population of Jamaica is estimated to be just under 3 million people. 92% of these individuals are Black. The majority of the population is comprised of the working age group, ages 15 to 54. Among this population, approximately 29,000 people are estimated to be living with HIV. Approximately 2,500 individuals were newly infected in just 2012 alone. This number continues to grow and will continue to grow without intervention through continued testing, treatment, and awareness on protection. The subpopulation that is most infected by HIV are the island's heterosexuals. This statistic may be incorrect, as being openly gay in Jamaica is frowned upon. Jamaica is not like the United States, where it is typical to see gay couples out in public. There is actually a law in Jamaica against anal intercourse. The Jamaican Offenses Against the Persons Act, informally known as the Buggery Law, makes it a punishable crime for any man or woman to engage in anal intercourse in public or private. The act is punishable for up to 10 years of imprisonment. As you can imagine, many citizens of this subpopulation do not wish to receive health care in fear of being punished by the law. This means that these individuals may be infected with HIV and unknowingly transmitting the virus, just because they are scared to receive medical intervention. Just as HIPAA does for the United States, health information is supposed to be protected by the Jamaican Constitution. This clearly contraindicates the act. Many fighting for an HIV-free society are trying to get the act appealed. If the act is appealed, then it will be easier to reach out to the subpopulation through prevention programs and medical treatment. Moving on. Statistics state that major modes of transmission include men who have sex with men, comprising 32% of the HIV-infected population, females who partner with bisexual males, comprising 7% of the HIV population, female prostitutes, making up 11% of those infected with HIV, the general population of heterosexuals, making up 22% of those infected with HIV, and transmission from mother to child makes up about 1.9% of the HIV population. IV drug use and blood transfusions are not major causes of HIV infections in Jamaica. Therefore, it is important for those who are planning and implementing programs in regards to HIV to know which subpopulation needs to be targeted to have an effect on the greatest number of people. The estimated number of Jamaicans infected with HIV in 2013 in need of antiretroviral therapy was 16,766. This accounts for about half of the HIV population in Jamaica. The number of individuals who started treatment each year rises. due to the public access program implemented in 2004. Since then, more than 10,000 people have started antiretroviral drugs. This sounds like good news, and it is. The bad news is the number of people who stay on the treatment plan is declining. Data states that amongst those who started treatment in 2011, only 74% are alive and are still undergoing treatment. This number could be affected by deaths unrelated to HIV, but there are various barriers as to why people stop taking treatment. Some of these include a lack of health care workers, lack of international funding, or barriers that are individualistic, like transportation to get therapy, embarrassment, stigma, discrimination, or financial hardship. Despite being a third world country, Jamaica does offer much care to its citizens in comparison with other third world countries. Across the island, there are 23 public treatment sites, which offer other health services as well. 75 certified practitioners offered services to patients in the private health sector. There are also 4 regional psychologists offering counseling to HIV-positive people. This may not seem like many, but they provided counseling to 1,300 people just between 2012 and 2013. There are many programs already implemented, helping to bring awareness of HIV to Jamaica and prevent the spread of disease. These include, but are not limited to, media campaigns, literacy brochures, educational curriculum to grade school students, intervention for sex workers, and condom distribution. Let's discuss some of these programs in further detail. First, it is important to keep in mind that different programs target different parts of the population. These next programs target those in the general population. Media campaigns such as Pinch, Leave an Inch, and Roll provides tips on how to properly use condoms. Smart Women Always Buy, Carry, and Use Condoms is another media campaign targeting women. There are 2 low literacy level brochures targeting young males. I love the names of these. They are Condom at Every Time Thing and HIV Test Mek We Dweet. As you can see, regardless of the way the message is conveyed, messages tend to focus on condom use and HIV testing. Some schools are using curriculum to teach students grades 7 through 9 about HIV. Targeted populations include males who have sex with males, sex workers, homeless persons, and inmates. Males who have sex with males is becoming increasingly targeted more recently. Empowerment groups are being provided to these HIV positive men, as well as increased access to treatment and condoms. Remember that this is the population most affected by the buggery law. There are also multiple strategies to help sex workers. Included is the increased availability of testing sites. If tested positive for HIV, sex workers are referred to clinics for treatment. Some sex workers are even offered small business loans to start a business where there were less health risks involved. Through support of the National HIV Program, homeless persons of Jamaica have an increased access to condoms, testing, and treatment. The Department of Correctional Services offers inmates opt-out testing for HIV upon entry into the correctional system. If an inmate tests positive, then they are able to receive treatment and follow-up care. Correctional officers are also provided courses teaching sensitivity to those with HIV. The southeast region of Jamaica in the island is being reached out to by HOT, which is the HIV outreach team. They are mobile, using a bus to reach the population who may not be able to reach a testing site. My favorite program is the Children of Faith program. This program offers opportunities to children infected with HIV or affected by HIV because they are living with someone who has the virus. In order to be involved in this program, households must include children. Household heads are taught skills to generate income, such as chicken rearing, retail clothing, cosmetology, and farming. Another program benefiting children was a 2-week summer camp in 2013. This camp provided sexual health counseling to children of sex workers in hopes to deter them from becoming sex workers in their future. It also provided attendees with school supplies. Funding these programs are the International Bank for Reconstruction and Development, grants from the Global Fund to Fight AIDS, Tuberculosis, and Malaria, the United States Agency for International Development President Emergency Plan for AIDS Relief, and of course the Jamaican government. The cost of these programs is projected to increase each year, making it even more important, with limited budgets, that programs are implemented to those populations most affected by HIV. As you can see, Jamaica is using multiple forms of funding to implement various programs in order to educate their population about HIV, reduce the incidence of HIV, and provide treatment and counseling to those infected with HIV. I hope you learned something about Jamaica and the effect HIV has on the island. Have a good day.